Endometriosis is a serious disease that affects an estimated 1 in 10 women. But despite being one of the most common gynecologic disorders in America, there is a lack of awareness and understanding of endometriosis as an important women's health issue. Dancer, actress, humanitarian, and entrepreneur Julianne Hough knows firsthand how the pain from endometriosis can affect one's life after being first diagnosed in 2008. She is joining us now to share her story along with Dr. Rebecca Brightman. Good morning to you both. Great to have you on.
Good morning.
Thank you for
having us.
Well, and as I just said, this is a serious disease. It affects a lot of women. Julianne, you were on the set of Dancing with the Stars and had such severe pain that you actually had to leave the set due to that pain, which you found out was endometriosis, right? What was that like? And did you know before this, or when were you finally diagnosed?
Well, I definitely was having symptoms beforehand, probably around 15 years old. But because I just thought that it was normal, as is part of being a woman, I just, I definitely thought that it was just, normal. So I went along with my life, and then in 2008 I was on Dancing with the Stars, and I was definitely having a lot more pain, and something triggered it, and I ended up having to leave and go to the hospital, and it kind of forced me to figure out what was going on. And in the past, when I had talked about it, I felt kind of weird, like, oh, this is just normal. So when I found out that I had endometriosis, it took me almost six to 10 years, something like that, to get my proper diagnosis. And when I did, it was a relief. I felt like, oh, this is more than just being a woman, like the normal things. And I felt like I didn't have to go through the debilitating pain and be such a tough cookie. I could actually start talking about it. And because I did, friends and siblings and my mom even found out that they had it as well. So the fact that, this whole campaign is about getting in the know about me and endometriosis, and that I am the me, that was, that's why I wanted to get involved.
Yeah. Well, and Dr. Brightman, is this something that runs in the family, or what kind of symptoms, as Julianne mentioned, should people be keeping an eye out?
Well, that's a great question. There absolutely can be a hereditary component when it comes to endometriosis, but women frequently blow off the symptoms of endometriosis and think that, oh, they're just having painful periods. Sometimes they have pelvic pain. They might have pain during sex. But these can be symptoms of endometriosis. So I think it's really important for women who have these symptoms to address the symptoms with their healthcare providers. And if they want to get more information, if they think they may have endometriosis, I would suggest they go to the website meandendo.com or join in the conversation at #meandendo to find out more information and determine whether or not they think they actually have endometriosis, because it's important that, again, that they seek their appropriate medical attention so that they can be appropriately treated.
All right, well, that online sounds like a great resource there, but what exactly is that textbook definition of endometriosis?
Endometriosis is a condition that occurs when there are little implants of tissue that are similar to tissue that's typically found within the uterine lining, but these implants actually occur on different parts of the body, particularly in the pelvis, on the bladder, most commonly in the ovary, on the fallopian tube, and often can affect the GI tract.
And Julianne, what has your journey been like so far after you were diagnosed? Did it affect your daily activities, or what has it been like so far?
Well, I mean, it's definitely something that I live with every day, and I think that, for me, it's just nice knowing that there is a name to the pain. I love that I'm rhyming, and that also, it's something that I can talk about, and that people understand the pain that I'm going through. If I'm on a photo shoot or something and I'm hurled over, I'm like, hey guys, can you give me just a minute? I don't feel like I have to just push through because I'm supposed to, and I can actually have support. And I'm such a female empowering person. I just want everybody to feel supported and that they have an option. They can go to the website, they can talk about it, and they don't have to go through the debilitating pain and make the same mistake that I did, which at 15 I didn't go and figure out what it was. I waited until I was really very much in pain.
Yeah. Well, we love what you're doing, and that you're really able to use your platform to share your story so that others don't have to suffer. And that really is the goal of this campaign, right? Well, what is the best way to get involved if someone wants to, you know, if they're
Yeah.
listening right now and they're saying that this sounds familiar and I've been experiencing those symptoms, what should they do? How can they help others and help themselves?
Well, you can definitely go to the website, meandendo.com, and there's a checklist of things so you can go through and see what maybe your symptoms are. But also, starting the conversation, you can use the hashtag on your social platforms, hashtag #meandendo, and start talking about it and just voicing it. I think that that's the biggest thing, is that, you know, when people start talking about it, it might not be necessarily you that has it, but if you start talking about it, it might be somebody else that has it. So getting in the know about me and endo is really important.
And Dr. Brightman, if any women out there are listening and are having trouble conceiving, could that be a sign of endometriosis and their ability to conceive or start a family?
It can, and I think if a woman is having difficulty with conceiving, it's something that they should raise with their doctor, because this may be playing a role.
Well, thank you both so much. And Julianne, before we go, we're following you on social media right here. I see that you are performing. You're actually going to be right here in Southwest Florida.
Yes, we will be in Fort Myers. Yes. Yes, Move Beyond, live on tour. My brother and I will be out there. So please get your tickets at moveliveontour.com.
Well, thank you so much for stopping by our sunny town here. If you'd like to learn more about what Julianne and Dr. Brightman talked about, head to our website, fox4morningblend.com.